right now, women are paying thousands of pounds at these luxury wellness clinics for bespoke natural menopause treatments.
Yeah, and the crazy part is they actually carry a higher cancer risk than, an 8-pound prescription on the NHS.
Exactly. It's
Yeah.
wild. So today we're taking a deep dive into the massive terminology trap of hormone therapy.
Right.
And to figure out if these compounded bioidentical hormones are actually safe and regulated for you to use, we've got a pretty dense stack of sources today.
We really do. We're looking at consensus statements from the British Menopause Society, NHS guidelines, reports from the National Academies of Sciences, and even some specific medical funding applications for new drugs.
Yeah, so our mission today is to cut through all that bamboo and spam music marketing you see online. We want to get down to the actual biological mechanics of what you're putting into your body.
Because the wellness industry has done just a phenomenal job of weaponizing the word natural.
Oh, absolutely.
They make regulatory oversight seem like a bad thing. And so we're dealing with this landscape where patients are fleeing perfectly safe, rigorously tested treatments.
Because the marketing of the unregulated stuff is just that good.
Exactly. It's incredibly convincing.
I have to admit, looking at these sources, I completely fell for the terminology trap myself before we started this deep dive.
Oh, I mean, almost everyone does.
Right, because you see clinics advertising bioidentical hormones, and then you read the British Menopause Society recommending body-identical hormones.
Yeah, bio and body.
They sound so interchangeable. I just assumed they were synonyms or like different brand names. I had no idea they represent two totally different universes of regulatory safety.
Most people assume they mean the exact same thing,
Yeah.
which is, exactly what makes the marketing so insidious.
Yeah.
But let's look at what they actually share before we split them apart, because both pathways do start with the exact same premise.
Right, the plant sources.
Exactly. They use hormones derived from plants, typically yams or soy, and they're synthesized to be a precise, perfect molecular match to the estradiol and progesterone your body produces naturally.
Okay, so the base molecule is identical. It's a lot like downloading a piece of open source software code.
Okay, I like that.
Like the base code is exactly the same. But if I download it straight from the official verified developer, it's secure and it works.
Right.
But if I download that exact same base code from some random unverified server on an internet forum, it might be bundled with malware. The code isn't the problem. The delivery and packaging system is where the danger is.
That analogy hits the core issue perfectly. The medical community splits these identical molecules into two very distinct categories based entirely on that delivery system.
Okay, so what's the verified developer version?
So first you have RBHRT, which
Right.
stands for Regulated Bioidentical Hormone Replacement Therapy. This is what the NHS and the British Menopause Society call body identical.
Body identical. Got it.
Yeah. Major pharmaceutical companies manufacture these. They undergo, rigorous phase 3 clinical trials, strict batch standardization, the works.
And government agencies actually oversee them.
Completely. The MHRA in the UK or the FDA in the US fully regulate them.
So that's the safe software download,
Yeah.
which means the unverified server would be the other category.
Right. Compounded bioidentical HRT, or CBHRT. These are the treatments sold in those high-end private clinics.
And they mix them themselves, right?
Yeah, specialist compounding pharmacies custom mix them on-site.
Yeah.
And the really critical distinction for you listening right now is that they completely bypass the rigorous MHRA or FDA regulatory pathways.
Okay, wait. I need to push back on that.
Sure.
Because how is it even legal to sell a medical treatment that just bypasses the MHRA?
Well, in the UK, they're supplied under what's known as the Specials Framework.
The specials framework, what is that?
Historically, it was designed as a loophole for really specific, rare medical necessities.
Mm-hmm.
Like, for example, if a child needs a specific medication, but physically cannot swallow the licensed pill version.
Oh, I see. So a pharmacist can compound a liquid version just for that one patient.
Exactly. It's for special circumstances. It was never intended to be used as a backdoor to mass-market, unregulated anti-aging or menopause treatments.
But I'm guessing that's exactly what happened.
Yeah, private clinics have turned this little exception into a booming, highly lucrative business model.
Okay, but to play devil's advocate, here we are seeing a massive shift toward personalized medicine across the board.
Oh, definitely.
In oncology, genetics, nutrition, in almost every other area of healthcare, a tailored approach is considered the absolute gold standard. So why is a bespoke, customized hormone dose such a massive red flag?
It's a great question. The problem isn't the concept of personalization itself. The problem is the biological reality of how our hormones actually function.
Okay, break that down for me.
Well, private clinics often run saliva or blood tests to justify their bespoke compounding, right? They tell patients, we're mapping your unique hormonal fingerprint to create a customized dose just for you.
Sounds very scientific.
It sounds great, but the flaw in that logic is that hormone levels fluctuate wildly throughout a single day,
Right.
let alone across an entire month.
Right.
Taking a single saliva test is like taking a photograph of traffic at 3 in the morning and using it to design a permanent highway system for rush hour.
Oh, wow. So they are creating a permanent daily treatment plan based on a fleeting, essentially meaningless biological snapshot.
Exactly. And then they compound it in a way that introduces entirely new risks.
Because there's no standardized batch testing.
Right. Because these pharmacies mix the hormones on-site for the individual, there's zero batch standardization. Studies analyzing these compounded hormones frequently find staggering inconsistencies.
Like what kind of inconsistencies?
Like one capsule might have double the requested estrogen, while the next capsule has a fraction of the necessary progesterone. Yikes.
But, okay, if my body naturally produces estrogen anyway, giving me a bit more in a custom pill shouldn't be inherently toxic, right? Where is the actual physiological danger coming from?
You have to consider the biological mechanism at play between those two hormones. Estrogen is responsible for thickening the endometrial lining of the uterus.
Right.
Progesterone's job is to stabilize that lining and eventually cause it to shed. So if you're taking a compounded mixture that accidentally delivers too much estrogen and not enough progesterone to balance it out,
The lining just keeps thickening.
exactly, you severely increase your risk of endometrial hyperplasia, which is a direct pathway to endometrial cancer.
Wow. So by trying to get a customized, quote-unquote, natural fit, patients are unwittingly gambling with their cancer risk.
Yeah.
Just due to simple human error in some back mixing room.
It goes even further than mixing errors, honestly. Compounded versions often throw in extra hormones that are completely lacking in safety data for women.
Like what?
Things like DHEA or pregnenolone. Or, more alarmingly, they'll prescribe the progesterone as a skin cream.
Wait, what's wrong with a cream?
The molecular reality is that progesterone is highly lipophilic, but the molecules are simply too large to cross the dermal barrier efficiently in the bases these pharmacies use.
Oh, so it just sits there.
Pretty much. The hormone gets trapped in the subcutaneous fat tissue. It never reaches the bloodstream in concentrations high enough to actually protect the uterus.
So a patient could be religiously applying a cream every single day, fully believing they're protecting their uterus from the estrogen they're taking,
Yeah.
when biologically, nothing is even reaching the target organ. That is terrifying.
It really is. And the Advertising Standards Authority in the UK recently caught on to this. They issued a ruling against a cosmetic clinic for misleadingly promoting compounded BHRT as safer and more effective than regulated alternatives.
Good, because they didn't have the data, right?
Right. The ASA's ruling explicitly noted the absolute void of clinical trial data to support any of those bespoke claims.
Okay, so if we are abandoning the idea of this custom backroom mixture for you, I need to know the regulated alternative actually works. Oh, it does.
Because if I'm giving up the allure of a tailored treatment, the standardized option has to be highly effective. Now, our sources include a medical funding application for a drug called Bijuv.
Yes, Bijou is a perfect case study for the regulated body-identical route.
Bijuv represents that massive difference between unregulated guesswork and rigorous pharmaceutical science, right?
Exactly. It's the first approved oral continuous combined body-identical formulation in a single capsule. It contains 1 milligram of estradiol and 100 milligrams of micronized progesterone.
And both of those are derived from plants, right? Both are exact molecular matches to the human body.
Correct.
And instead of paying those insane private clinic prices, patients can get this on the NHS for like £8.14 for a 28-day pack.
The cost difference is staggering.
But I want to zero in on the terminology in that Bijuv application. It specifies micronized progesterone.
Yes.
I assume pharmaceutical companies don't just throw that word in for marketing flavor. What is the actual biological difference between standard and micronized? It actually solves a massive physiological hurdle. Progesterone is notoriously difficult for the human body to absorb orally.
Oh, really? Why?
If you just swallow standard plant-derived progesterone, your digestive system and your liver will destroy almost all of it before it ever reaches your bloodstream. It's a process known as first-pass metabolism.
So the liver just filters it out as waste.
Basically, yeah. So micronizing means milling the hormone particles down to a microscopic size and then suspending them in oil.
Okay.
This massively increases the surface area, allowing it to be absorbed efficiently through the gastrointestinal tract and survive the liver's filtration process.
It's fascinating how a purely physical change, literally just grinding the particle down smaller, completely alters how the human body processes the hormone.
It changes everything.
And because it's a regulated medicine, Bijou had to prove this actually translates to patient outcomes, right?
Exactly. The Replenish Phase 3 clinical trials provide that proof. This
Hmm.
was the 12-month, randomized, double-blind, placebo-controlled study,
A gold standard.
the absolute gold standard. The data proved that this specific micronized formulation yielded statistically significant improvements in vasomotor symptoms, like hot flushes,
Right.
and sustained improvements in sleep parameters over the entire year.
Okay, so that covers efficacy. But we have to address the elephant in the room regarding hormone therapy, which is the historical fear surrounding it.
Right, the breast cancer fears.
Exactly. For 2 decades, the dominant cultural narrative has been that HRT causes breast cancer and blood clots, mostly stemming from that Women's Health Initiative study in the early 2000s.
Yeah, that historical context is crucial because it really explains why so many women ran toward unregulated compounded hormones in the first place.
Because they were terrified of the medical option.
Exactly. But you have to remember, the older studies, including the WHI, analyzed women taking older synthetic progestins, and those synthetic molecules did carry higher risks.
But the body-identical ones are different.
Completely. The clinical data on regulated body-identical hormones tells a completely different story.
Yeah, the application cites the French E3N cohort study,
The E3N, yes.
and that tracked over 50,000 postmenopausal women. You simply cannot generate that volume of long-term data from a private compounding clinic.
No, you can't. The scale of the E3N study is matched only by the importance of its findings.
What do they find?
The researchers proved that when women combined estrogen with those older synthetic progestins, their risk of breast cancer increased significantly.
Okay, as expected.
Right. However, when women used estrogen combined with micronized progesterone, the exact body-identical kind found in Bijouve, there was no evidence of increased breast cancer risk compared to women who never used HRT at all.
Wow. So because the micronized version perfectly matches the human molecular structure, it just doesn't trigger the adverse cellular reactions in breast tissue that the synthetics did.
Exactly. The molecule's architecture matters just as much as the dosage.
That makes perfect sense.
And we see that same architectural importance when looking at venous thromboembolism or blood clots.
The Esther study, right?
Yes. The French Esther study investigated this specific risk. They found that older oral synthetic progestins increased the risk of blood clots fourfold.
Wow, awful.
But transdermal estradiol combined with micronized progesterone was not associated with any increased VTE risk compared to non-users.
Wait, you mentioned transdermal estradiol there. So for patients who have an inherent high risk for blood clots, does the delivery method of the estrogen change?
Yes, it does. For patients with elevated clot risks, the guidelines recommend transdermal estradiol as the first choice route, meaning, a patch, a gel, or a spray.
Okay, why does the skin change the risk profile?
When estrogen is absorbed through the skin, it goes directly into the systemic circulation, completely bypassing the liver.
Oh, back at the liver again.
Exactly. Oral estrogen has to pass through the liver, which can actually stimulate the production of clotting proteins.
Got it.
By bypassing the liver with a patch or a gel, you eliminate that specific coagulation risk entirely.
The level of precision in regulated medicine is just incredible. You can have the exact same plant-based molecule, but just adjusting the delivery mechanism from a pill to a patch neutralizes a major cardiovascular risk.
It's remarkable science.
And that brings us to the broader picture of menopause management. Because even when patients accept that these regulated options are safe, there is still this persistent myth about duration.
Oh, the 5-year rule.
Yes. I hear constantly that you should only take HRT for the shortest amount of time possible just to manage symptoms, and that there is a strict 5-year cutoff.
That 5-year rule is a pervasive hangover from the era of synthetic hormones. If you look at the British Menopause Society's 2020 recommendations, they actively debunk this.
They say you can stay on it longer.
They clearly state there should be no arbitrary limits placed on the duration of HRT usage. The duration of therapy should be individualized based on a continuing conversation between the patient and their clinician.
It really seems like framing HRT merely as a short-term fix for hot flushes completely ignores its role as preventative health care.
It does a massive disservice to long-term female health. I mean, look at bone density.
Right.
As estrogen levels plummet during menopause, osteoclasts, the cells that break down bone tissue, become overactive. Women lose bone density at an alarming rate.
Then HRT stops that.
Yes. The British Menopause Society explicitly positions HRT as the first-line therapeutic intervention for preventing and treating osteoporosis in menopausal women under 60. It actively suppresses those bone-destroying cells.
So it's actively preserving the structural integrity of the skeleton. And our sources point to systemic benefits well beyond just bone health, too.
Oh, definitely. The BMS consensus highlights Cochrane analysis data, demonstrating that starting HRT before the age of 60 or within 10 years of the onset of menopause reduces the progression of atherosclerosis.
Plaque buildup in the arteries.
Exactly. It lowers the incidence of coronary heart disease, and it even points to a reduction in all-cause mortality.
Wait, really? So the data implies that women who start regulated HRT during that critical window actually live longer while protecting their cardiovascular system and preserving their skeleton.
Yes. The consensus also notes it does not increase the risk of dementia and may actually offer protective benefits for cognitive function if it's initiated early enough.
That is incredible.
The overarching medical consensus is profoundly clear here. Provided a patient does not have a specific contraindication, like a personal history of hormone receptor-positive breast cancer, the long-term systemic benefits of regulated HRT dramatically outweigh the risks.
It is remarkably refreshing to see rigorous, peer-reviewed data dismantle the fear-based marketing that surrounds female aging.
It really is.
And it brings us right back to the core mission of our deep dive today. We set out to understand the terminology trap, and for you listening, the distinction couldn't be starker.
No, it couldn't. The two pathways might share a starting plant, but they end up in entirely different universes of clinical safety.
On one side, you have compounded bioidentical hormones. They're incredibly expensive, they exploit regulatory loopholes to avoid oversight, their custom mixtures lack standardization, and they use delivery methods like those creams that biology simply won't absorb.
And on the other side, you have regulated body-identical hormones.
Yeah.
They offer the exact same natural, plant-derived molecular matches, but they are backed by tens of thousands of data points.
Real science.
Right. Strict standardized dosing, proven physiological mechanisms like micronization, and the safety oversight of global health authorities.
As we wrap up this deep dive, there is a fascinating forward-looking aspect to all of this, because the wellness industry's obsession with bespoke treatments isn't going anywhere.
No, people love the idea of customization.
Exactly. It's just currently lacking the technology to do it safely. But as artificial intelligence and wearable tech advance so rapidly, it makes you wonder about the future of personalized medicine.
Oh, for sure.
Like, how long will it be until we actually can map our real-time, hour-by-hour hormone fluctuations through, say, a dermal biometric tracker, and then have a regulated, FDA-approved 3D pharmacy printer create a perfectly bespoke, scientifically standardized pill right in our own homes?
I mean, the tech isn't as far off as people think.
Right. True. Safe personalization is likely coming. But until we have a regulated pharmacy printer synced directly to our bloodstream, it begs a really important question. In our modern quest for highly personalized health solutions, at what point does our distrust of big pharma actually lead us to abandon basic scientific safety standards? Something for you to think about. Until next time, keep digging into the data.